Living well. Living well really is the aim of any of the human being in our life, starting from any child patient to any adult growing patients. So what we'll try to do in our program is to give you the medical information in a very light meal and in a very simple way and language. We'll try to discuss about diseases, the causes of the diseases, the symptom of any disease, and then we'll finish by trying to treat or suggest any treatment for those diseases. So the aim of Living Well is not only yours, it's also our aim in our program to give you a very light meal of medical information in a very simple language. So just bear with us in our program and we'll try to be a very, let's say, light guest in you every week. Hi. One of the most noble things that the patient usually will do, or let's say any person in the community can do, is a blood donation. Blood donation is the voluntary, let's say, transfusion of blood, or giving blood or drawing blood in a blood bank facility. And sometimes the blood donation, it will contain the whole, let's say, content of the blood, or sometimes only a fractionated or part of the blood which is donated, for example, the plasma. So giving the blood or donating blood involuntary without any, let's say, commitment to the, let's say, blood bank is what we call it blood donation. Why it's important to have a blood donation? Simple. Most of the time the need of blood will be very urgent. For example, patient in surgery, patient involved in road traffic accident, patient which is involved in complication of any minor, let's say even surgical procedure or an endoscopy. These patients usually will be in a very urgent situation to have a blood donation or to receive blood or to do blood transfusion to them. So from that point of view only, the importance of the blood donation will come to the community. Supporting the community with the blood donation is very important and very crucial to maintain a very high standard of medical service. You might know that starting, let's say the medical service in Kuwait up to the year 1975, Kuwait was importing blood from Lebanon, but starting from that time, Kuwait had a blood bank and they start to collect blood or to emphasize the blood donation in the community, which really have a very positive effect on both the donor and the patient who receive the blood from the donor. Usually the blood bank is the place where the patient will go to donate blood. And starting from the beginning, usually what they will require to have is an ID of the patient, and then the patient start to, let's say, answer a questionnaire. The question usually in the questionnaire usually will involve his physical activity, his past medical history, and even his current medical history, his habits, any medication that he's taking, any chronic illnesses that the patient is having, or any acute illness that the patient had in the past, which was resolved completely or unfortunately complicated by other medical issue. One of the most important things that any blood which is donated through the blood bank is screened for all the, let's say, transmitted disease, for example, the HIV or the AIDS. It's very important to screen the blood for, and this is happening in Kuwait. Another thing is the viral hepatitis. All kind of viral hepatitis is screened in all the blood that is donated in Kuwait, along with some medical tests usually performed in the blood that is donated through the blood bank. So let's say the main issue or the main purpose of having a blood bank is to control the blood donation process, to have the blood donation done in a very secure medical atmosphere, and then also to ensure that the patient who perform the donation do not have any complication of the donation, which I will talk about later, despite the fact that these complications are very rare and it will happen only in a very minor and minimal percentage of those patients. So starting from answering a questionnaire concerning the past medical history of the patient or even the current medical history. After that, he will see a physician who will examine him, measure his hemoglobin level, making sure that the patient is able to donate, and then just sending the patient to the, let's say, the donation station where he will donate blood in a very comfortable atmosphere. One thing that you might heard about is the therapeutic phlebotomy. Therapeutic phlebotomy is the taking of the blood of those patients who have hemoglobin in a very high numbers, for example 17.5 and above, 18 or 18.5. Those patients, usually it's a therapeutic donation. The patient will donate blood through what we call it therapeutic donation or the phlebotomy or therapeutic phlebotomy. Usually those patients will be smoker patients with chronic diseases, and for example they require donation between each couple of months. So what are the complications that might be associated with the blood donation? Honestly speaking, the complication usually it's something very minor. For example, hypovolemia, let's say the volume or the blood pressure will be decreased during the donation, fainting, which sometimes happen to those patients, and it's most of the time due to psychological reason, and the bruising on the site of the donation. So these minor complications are really very minor and they are not serious at all, but it should not stop anyone from donating blood, because donating blood is really creating a life for other person.